Today on Vital Insights.
So typically when you integrate into the EHR, it's about how do I get information from the EHR and create this two-way exchange with patient IDs and PHI and PII. So we asked if there was a simpler way to do that interface.
Welcome to an episode of Vital Insights, a podcast series focused on thought leaders and healthcare providers who are working to transform the way we care for patients, now and in the future. The implementation of remote patient monitoring solutions has consistently had a prominent sticking point impeding its success. And that was in the translation of patient data that was collected by the patient and then providing that data to their care provider. Making that process seamless was core to our next guest solution. Sid Kandan joins us today as co-founder and CEO of Stel Life Inc. to walk us through how his company has been able to partner with healthcare providers to ensure the data they receive from patients is complete, reliable, and accurate. Welcome to Vital Insights, Sid.
Thanks for having me on, Liz. It's an honor.
Absolutely. So let's jump right in. Could you provide us with a brief description of your solution?
Sure, yeah. We started out with a Bluetooth and cellular home vitals hub that has no buttons or switches. It's just this little black box that patients plug in at home. And we made a really simple hub. So when patients take any vitals device measurement within 100 feet of the hub, we'll automatically pick it up and send it over cellular right into their EHR or care team's preferred digital health platform.
That is incredible. Can you tell a story to kind of highlight how that happened?
Yeah, sure. So with the evolution of the product
absolutely. Absolutely.
So it's funny enough, we actually started off with a smart toilet and smart water bottle.
Oh my gosh. Okay. Great. Yeah. I love this. I love this. I'm already in. I'm drawn in. Yeah. Keep telling me.
Oh, yeah. So that was quite an evolution. My journey before this, 6 years ago, I was working at Facebook and really passionate and excited about Bluetooth Low Energy. And initially, I just thought of it as the future where your devices could really support you in your health goals. Your water bottle could care about how hydrated you were. Your toilet could tell you if the diuretics were working and were effective. And when I presented our initial prototype way back in the day to some doctors at Mount Sinai, they were excited about opening it up to their patients. And they went as far as to invest in us to allow me to pursue that opportunity and dream. Starting that process and flow, we realized the true challenge wasn't necessarily the sensor technology and the devices, but really the workflow, as you highlighted in the beginning.
Yeah, absolutely. Absolutely. So if you imagine your solution today, who is the intended user of that solution? Define kind of what they look like. What is their life like?
Yeah, so the end user would be the patient that is managing their chronic condition.
Okay.
We really wanted to design a solution that didn't introduce more technology into the mix, but remove technology. So we made a little black box that patients simply have to plug in and not worry about any other settings, any other infrastructure. They don't need Wi-Fi. They don't need data plans of their own. They would just have to use their vitals devices. And on the care team side, if they were brave enough to adopt remote patient monitoring and step into this new future of remote care, they would have an experience where the data just goes where they expected it, right into their EHR. They wouldn't have to set up Genius bars at their hospitals to help patients and their IT support teams support care navigators. It would just work from device into the record, allowing patients and care teams to feel more connected with each other.
Absolutely. So I know from the healthcare provider side, that's often a challenge, like the integration of a new type of data. How did you work with healthcare providers to ensure that that was a seamless process?
Yeah, it was quite the challenge.
I can imagine.
Yeah, it was an evolutionary process, honestly. We just stepped through it, and we've been fortunate enough to play this game for long enough for a number of years to eliminate steps and hurdles. Our team has a big list of barriers to yes on the board. And so that ranges from contracts to IT integration to data architecture. And we just went through and checked off the items on the list. So typically when you integrate into the EHR, it's about how do I get information from the EHR and create this two-way exchange with patient IDs and PHI and PII. So we asked if there was a simpler way to do that interface. And we found that if you do a one directional pipe where you don't retain or take any of the PHI, IT teams and care teams are way more amicable and willing to connect with you and invest in your solution.
That's fantastic. Can you talk about an example of how that happened, like a real world example, obviously without using any names or anything like that?
Yeah, I can highlight some names as well. We're really proud of some of our integrations. So Lehigh Valley Health Network has been a great partner to ours of ours, and they use their interface engine to accept the payloads and information. So that's just a fancy way of filing it into their Epic system. So once we push the data and payloads to their interface engine, that engine can bring it to the right patient chart. And the way that it does that is under their Epic Identity Manager profile, they just have to barcode scan our Hub ID to the patient ID, and they're the only ones that have that association. As soon as they do that from a provider workflow, that's really all they have to do. And then data will show up right into the patient-generated health data flow sheets. And so part of the ONC's Interop Level 3 requirements, EHRs needed to have this method to handle this set of data. So it comes for free in many EHRs. So thanks to the ONC for making that happen and really promoting our adoption and integration.
Absolutely. Absolutely. So let's talk a little bit about scalability for your solution specifically. Do you feel that as though, I mean, it sounds to me like the obvious answer is yes, but do you feel that that scalability is a factor at all? And if it's not for you, is it for the providers or the patients?
I love that question. So we designed our solution really to tackle that. When you look at remote patient monitoring at a lot of health systems and a lot of practices, it's usually stuck at a pilot phase, right? A lot of systems and admins are looking for the business use case and the final financial use case of it. And in order to spin up your team and a program to tackle this problem, it's a big, heavy commitment and investment. So to take that leap of faith, a lot of people like to dabble and do these initial pilots. And as a result, they are met with vendors that have to do a lot of the services and a lot of the initial setup and the implementation, housing of the data. And as a result, you're left with high implementation fees, high device fees. You have to buy tablets for people.
Right. Absolutely.
That flow. Yeah. So we decided to say, all right, if that's not working, and that's not promoting scalability, what can we take away from that? So we took away the implementation fee. We made a very simple way to integrate and implement. We took away the maintenance fee and the platform for visualization and tried to coach and standardize the workflow for digital health companies and platform manufacturers, as well as Vitals device companies to get it into EHR. We created a straight to EHR level protocol, or a Stel protocol, in which the data could be accepted and visualized and easy to use in the EHR, because we thought that was core for a care team to interact with this data.
Absolutely.
So the last thing was cost. So we priced our unit to be cheaper than an Android phone or tablet on the market. So it really allowed for scalability of the solution. You could buy this Vitals device for patients that don't have Wi-Fi, that don't have self-service, and trust that you're only hit with those two costs, the cost of the unit and the monthly service. And if there's no usage of the devices, then we don't charge you for the monthly service.
That's fantastic. I love that you touched on cost, actually, because I'd love to dig into that a little bit. Specifically with respect to return on investment. So what types of measures have you been able to discern and tease out there?
Yeah, excellent question. So we did the traditional RPM study with a big health system. We did a pilot study with 60 high-risk CHF patients, and they were able to reduce their 30-day all-cause readmission rate by 50%.
Wow.
Their 7-day all-cause readmission rate by 83%.
Oh my
their
gosh.
3-day all-cause readmission rate by 100%. It was a really credit to their care team and the nurse navigators behind that program, and the patients also participating. So we hit those financial drivers. The second avenue of it is the RPM codes, which we can touch on if you're interested.
Yeah, absolutely. Please do. Please expand.
Yeah, so I mean, it's funny. I think everyone always lumps us into those RPM codes, and we've we I guess it's a little bit warranted because we priced our solution to be somewhat competitive with those RPM codes as big drivers. It's easy to integrate a solution when you know there's some revenue on top of it.
Yeah.
The one thing that we found though from the CMS study that just came out in 2019 when the codes first became available, there was only 20,000 claims for all that year for the
Oh
setup
my.
of the devices. Yeah. And for the monitoring services and the usage service, there was only 50,000 claims each. So to put that in perspective, so CMS for these RPM codes in 2019, when it first came out, paid less than $6 million for all of it.
Oh my.
I, I swear from the marketing budgets and all the ads that we see, I'm sure marketing for those RPM codes by VCs definitely eclipsed that 6 million budget. And
Yeah.
it's when you put that in perspective, 20,000 claims to 60 million Medicare participants, that's like 0.03% of filings or so. Um,
Like
so
nothing. It's nothing.
yeah, exactly. So I think there's better vehicles for financial incentives and adoption of these
Ab-
devices.
Absolutely. So let's shift gears to the patient a little bit. Like one of the
Yeah.
major issues we see with especially with traditional remote patient monitoring services is patient compliance, which is not a knock on patients. It's really about human error. I mean, remembering to get on your scale in the morning, remembering to, take your blood pressure at a certain time or take your medication at a certain time or fill out that form you have to fill out for somebody. How does your product solution impact patient compliance? And what do you see with respect to patient compliance trends in the marketplace?
Yeah, I think WebMD kind of showed us in the early days that technology may not be the best solution to encourage compliance. So we took a different method to tackle that problem. I think our belief from my previous world in the big tech companies, patient change, behavior change is really, really difficult. That's a really tough problem to solve. We didn't think that we could tackle that with engagement tools and web flows. I know there's a lot of digital health companies doing great work there, but our belief was really connecting them to their care team, because if a patient feels connected to their care team and that their care team actually cares about them, there's this special kind of loyalty that we've seen firsthand, improve education, improve learnings, understandings of how to manage conditions, and we've seen patients get better over time. So we eliminated compliance to be simply take your vitals measurements. That's it. Just plug in the device, take your weight every morning,
Yeah.
and take your BP, take your glucose levels, because we found that if you're able to control your chronic conditions by these small incremental steps, that's what's going to make all your chronic conditions better, right? If you're able to manage your diabetes better, if you're able to manage your various chronic conditions, that will impact all the conditions that the patient is encountering and dealing with, and prevent an escalation event where they end up in the ER.
So you've talked a little bit. You've touched on some methodology for measurement. Weight, blood pressure, et cetera. How do you feel about the future of kind of continuous monitoring solutions? So you're familiar with early census technology and how it kind of works. How do you feel like that's going to play into your solution's ability to deliver in the future, and any other insights you want to toss in?
Huge fans of you guys' work, and really looking forward to exploring opportunities together. So the name Stel is actually short for constellation, and we built our whole identity on that notion that if you see one star in the sky, it's cool, but if you see a bunch of the stars and collect them, you can see the stories behind it. So we're helping
Oh,
you
I love
collect these data
that.
points for the
That's
true
great.
stories. Yeah. So I think what you guys have there is really the future that we want to promote and help enable. Right now, it's all these spot checks and spot devices because people are learning how to ingest it in the workflow and act on the data sets. And there's so much infrastructure involved for even just the spot checks of it. So we designed our operating system for manufacturers as well and digital health companies to really to forget about all the infrastructure. You don't have to worry about maintaining an app or all of those additional overheads that app manufacturers, vitals device manufacturers were responsible in the past. The data will just stream to your cloud, and you could get the data to the patients and the providers at the right time when intervention is necessary.
You touched on one thing that is near and dear to my heart, which is patient empowerment, that idea of being able to take control of your own health. How has that informed the development and ongoing kind of dreaming about where you'll go in the future with your solution?
Yeah, I think of it as patients feeling close to to their care teams and to that workflow essentially, right? So there's the whole BYOD model that I think a lot of people try to tackle in the past, but it was very difficult to see how that would relate to the patient, right? If a patient is empowered to take their vitals, they're probably not going to have that chronic condition, over time. So I think it's about like collecting the data and bringing the relevant triggering point or action to the patient and the care team at the right time. So that's really tough for patients that need this the most, right? Patients that don't have Wi-Fi, that don't have cell phones, that don't have data plans or the required infrastructure for this new level of care, I think are at a massive disadvantage. And I think part of our company's DNA is really focused on creating solutions for those patients that don't have the right technologies to participate in this new era of care.
That's fantastic. Do you have a for instance related to that, like a story you can share?
Yeah, I'm so proud of Yale New Haven Health's Fairhaven's FQHC up in New Haven. They're fantastic. So during the pandemic, they received FCC funding
Okay.
for this critical safety net population, patients that were lacking tools but lacking insurance. Right, it's an FQHC. And during the pandemic, right, when everyone was dealing with supply chain issues and new processes and overloaded units, they stood up a remote patient monitoring program.
Oh,
Like,
wow.
just let that sink in. They don't have any RPM code reimbursement structures, but they were able to stand up an RPM program, get devices to these high-risk patients, get the data into their EHR, act upon it, and really enhance care. So I think like now we're at this world where providers, even without like the proper financial incentives, are able to adopt this new technology to treat their patients, especially the ones that don't have access to the privileged technology and privileged new, I guess, privileged new care, new era of care.
So, did they have any specific data points of results that you're particularly proud of? You've been sharing some great data, so I wanted to dig into that if you had it readily handy.
Yeah. So they have hundreds of hubs out, so that they've been doing it from a very volume-based approach. They did a COVID response. They're doing a lot of glucometer and diabetes management. I think diabetes is a critical use case for a lot of these remote patient monitoring tools. So it's really encouraging and awesome to see how they rolled out one of these programs rapidly and have been scaling it to other chronic conditions.
That is amazing. I'm so happy for you guys and so proud of your company. It's such an incredible solution and so needed in the marketplace. By way of wrap up, I'm going to invite you to dream a little bit, which I like to ask people to do. So what is kind of the future of virtual care look like for you?
Yeah, I think it's really that emphasis and spotlight on accessibility and innovation focused on non-privileged solutions, really enhancing care for all in this new structure. I think the pandemic has brought about a new normal where it's changed channels of care, but hasn't guaranteed access to this new channels. So I think there's going to be a simpler world where there will be digital health companies to help supplement EHR tools for providers and physicians. And there's going to be a slew of sensors like yours and really awesome work from you and your team, where we're going to collect data from these patients that are dealing with conditions that I think historically we haven't been able to get data behind. And we're able to actually intervene and treat and care for these patients in a low cost, affordable, scalable manner.
That's fantastic. Thank you so much for joining us today. If people want to know more about your company, where can they go for more information?
Yeah, thanks so much for having me. You can check our site at www.stel.life, Life. Yeah, and we're on Twitter and all the socials, LinkedIn. But yeah, our website's probably the best. Thanks so much, Liz.
Thank you so much for joining us.